DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Hi there, folks. Welcome to DocTalk. I'm Dr. Dan Thompson. I'm tickled to death that you joined us today for the show. We're going to talk about cattle handling and cattle facilities, and it's something that we do on a day in and day out basis in the beef industry. I hope it's a good show. I hope you enjoy it, and I hope you learn something. And I always do whenever I'm out working at different facilities, working with different cattle and working with different people. Thanks for joining us today on DocTalk, and I'll see you right here after the break.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
Hey there, folks. Welcome to DocTalk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, where I'm a professor, and I also direct the Beef Cattle Institute. And usually I have a guest, but every once in a while I fly solo here on the show, and today you're stuck with me. But I think we'll get along all right, as we're going to talk about something that I have a big passion for, which is low-stress cattle handling. And this is one of those things that I learned a lot from my dad. I learned a lot from my grandfather as working in their veterinary practices, learning from different producers and cowboys and hands. There are also people that go around the country, Kurt Pate, Tom Knopfsinger, Temple Grandin, Kip Lucas Savage, Bud Williams. All are people who teach low-stress cattle handling out there in the field. We also have people like John Mulhagen down at Silencer that are producing chutes, Danny Daniels up in Nebraska that has the Daniels system, and Bud Box and Snake and Tub, and all of the people working together with producers to continually improve low-stress cattle handling. Now, animal rights groups use animal abuse incidents to drive animal welfare legislation, and a lot of times we try to mix these terms around and confuse people, but animal welfare is so different from animal rights. Animal rights is the belief that animals have the same rights as humans, and I just simply don't believe that. Animal abuse is something nobody wants to see happen to an animal. As a matter of fact, it's a crime. And number 3, animal welfare, well, that's what we do every day. That's doing the chores, that's preventative medicine, that's providing nutrition, that's the human-animal bond interaction. And when we talk about animal welfare, the 5 guiding principles from the Food Animal Welfare Commission come from the 5 freedoms are freedom from thirst and hunger for our domestic animals, freedom from discomfort, which is our pen conditions and cattle comfort, freedom from pain, injury, and disease, and this is that veterinary client-patient relationship, the freedom to express normal behavior. Can they stand up, lie down? Can they seek shade? Can they move around in the pen? Different things to that nature. And the last one is the freedom from fear and distress. And the freedom from fear and distress is really that human-animal interaction. And so how do we interact with the animals, and specifically, how do we move them around? Now, there are some new audits and assessments that have come out. The big ones that we're going to utilize that are kind of the gold standard of the industry are called the assessment tools from the Beef Quality Assurance Program. And you can find those on the website at www.bqa.org. And there's a cow-calf assessment, BQA assessment, there's a stocker BQA assessment tool, and there's a feedlot BQA assessment tool. All the assessment tools incorporate things such as, do you have best management practices for antibiotic residue avoidance, injection site castration, dehorning, many of the painful procedures, are you being trained appropriately? They also ask things such as, are you a plan for emergency action if we have too big a snowfall or rainfall or heat stress? All these things that improve animal welfare. But the one thing they also include is a live animal handling section. And as we're going to go away to break, and as we come back, we'll start to delve into the Beef Quality Assurance Assessment tool and talk a little bit about the aspects that they have for beef cattle handling and some of the things that they're looking at that you can objectively score your beef cattle handling at your operation. I'm Dr. Dan Thompson. We're going to take a break and more Doc Talk after this.
This Meet the Veterinarian is brought to you by Merck Animal Health, the science of healthier animals. Dr. Laird Lawrence is the founder and owner of Hill Country Veterinary Clinic, a mixed practice located in Fredericksburg, Texas. Dr. Lawrence is a graduate of Texas A&M University and has served as Technical Services Manager of U.S. Cattle and Small Ruminants for Merck Animal Health since January 2013.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here from Kansas State University. I got the K-State purple on, and very thankful for the opportunities that Kansas State University has given me and the opportunity that Farming Unlimited and DocTalk have given me to be able to spend time with y'all on these very important issues. At least they're important to me, and I hope that they are to you as well. But we're pretty lucky to be in the business of the beef business. And when we start to look at this BQA Feedlot Assessment, and whether it's feedlot, stock, or a cow-calf, we're going to use the same type of objective measures to measure your cattle handling proficiency with any of the three. And it's how do you use driving aids like hot shots, and how often do you use them? Are cattle falling down upon release? Do cattle stumble or trip? Do the cattle vocalize prior to a procedure being done? So are they miscaught in the chute? And if they are miscaught in the chute, you have to readjust. And the big miscaught is if you catch them by the temples, we're going to release, let their head come through, and catch them appropriately. If you don't release them and re-catch them, that's an automatic fail of the assessment. And the last one is, are the cattle running or jumping, exiting the chute? And everybody always asks, oh man, you mean cattle can't run exiting the chute? No, what I'm saying is they can lope out of the chute, but we don't want to see over 25% of them with the tails up, sprinting out of the chute. Somebody did something bad to me back here, so I'm trying to get away from it out here type of a deal. So the NCBA, the Beef Quality Assurance Assessment Tool, has what we call acceptable levels or tolerance levels for these types of activities. And I'll just go through these as no more than 10% of the cattle can be touched with an electric prod or a hot shot, okay? No more than 2% of the animals can fall exiting the chute. And when I see cattle fall exiting the chute, generally they're coming out of the chute onto a slick surface, and we're asking them to make a quick right turn or left turn. And when they turn, after 2 or 3 of them start to get a little bit of a sheen on the ground, we'll get those cattle, their feet to come out from underneath them, and they'll fall. So straight out exit is always good, and if it's not going to be a straight out exit, having sand, gravel, or some sort of base or rubber matting that allows those cattle to get a grip and move. No more than 25% can run, again that's tails up, sprinting out of the chute, and no more than 4% of the cattle can vocalize. Now this is before we castrate or dehorn or ear tag, and most of the time when we have cattle vocalize in the chute, they've been miscaught. And what I mean by miscaught is that they're crooked in the chute. And if you'll just let off the sides, let them adjust and stand up, they'll quit vocalizing and they'll be fine. As we move through the facilities, and one of the things that people need to understand, that moving cattle to the chute is about as important as will elicit the reaction of the cattle exiting the chutes. But as cattle exit the chute, we can tell a lot about how they were handled prior to the chute. And what we're going to do in the next segment is we're going to go through a series of pictures looking at cattle and different things that you can do to help cattle flow through a facility to the squeeze chute, which will decrease your scores on the farm when you do this BQA assessment as they're exiting the chute. You're watching DocTalk. We're tickled to death that you joined us. We're going to be back after the break. Thank you.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. This tip brought to you by Batril 100 Enrofloxacin Injectable. The only enrofloxacin labeled for single-dose administration in cattle is also the only enrofloxacin labeled for control of BRD in high-risk cattle. Batril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hello, I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Quick tip for the day is, how often are you cleaning your water tanks? I'm a stickler for water tank cleanliness. Water drives consumption in cattle. Water also drives health. With inadequate consumption of water, we have decreased consumption, and we're darn sure going to have decreased health. It's a must that we clean these tanks once a week, all the way up to we have our round tanks, stock tanks, whatever it may be. Stock tanks maybe not once a week, but we need to make very sure that those tanks are clean, free of algae, free of debris, free of feed and grass. We want to supply good, clean water. So go out today, check those water tanks, clean them, keep them as clean as you can. We want happy, healthy cows. Thanks.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Batril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Batril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Batril 100, right the first time.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Your cattle are often at risk of respiratory disease caused by Mycoplasma bovis. But MPB Guard vaccine can help prevent those problems early. MPB Guard delivers proven efficacy against Mycoplasma bovis, even on young calves just 45 days old. It also gives you the convenience of an initial 2-dose sub-Q vaccination series. So help guard your cattle from costly respiratory disease caused by Mycoplasma bovis. Just ask your veterinarian about MPB Guard vaccine.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, Weighing systems, electronic identification (EID), electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. We're talking about the Beef Quality Assurance Assessment tool, and we've talked about some of the parameters that we're going to measure when we judge low-stress cattle handling. Now I want to talk about a few things that can help you flow cattle through the chute a little bit better. One of the behaviors that cattle elicit or exhibit is they prefer to move from areas of dark to light, not light to dark. And so one of the trouble areas of moving cattle into a facility is when we go from the outside to the inside of a building. And things that you can do to transfer and prevent shade or areas on the ground to not spook cattle or balk them to have them come back on top of you are always good to do. Now, cattle aren't afraid of shade, but when they're worried about you or somebody else moving them around and they catch shade or a change in light outside, it can cause cattle to balk, and it's something that you need to pay attention to, as we can see in this picture. The inside of a working facility, as explained to me by Dr. Temple Grandin, should be lit similar to what the outside looks like on a cloudy day. So, as we can take a look at this picture here in this slide, we do some things such as putting these vinyl panels and different types of see-through panels into the ceilings and into the walls, and we try to bring in some natural light into these working facilities or into clinics. Just makes it a more enjoyable place to work. It makes it an easier transition from outside to inside for cattle, and it doesn't hurt too bad as a person to either to be in there with a little bit more of natural light and natural environment. One thing that makes cattle very anxious is not having very good footing. And you will increase the stress rate and decrease the ability of cattle to move effectively in a system if we don't have proper footing. Whether it's a tub or whether it's an alleyway, when cattle are on ice or on slick surfaces, they really have heightened awareness and they are more difficult to move and they're more anxious. So one of the things that we look at, and I will inspect, whether it's in the lead-up alley or whether it's in the tub or whether it's in the snake or whether it's the alley exiting the chute, I'm always looking for ways to make sure that we have traction on the floor, whether it's grooves in the concrete, and generally we do 1.5 by 1.5 grooves in 8-inch diamonds on floors, as you can see in this picture, or we're going to use rubber matting. Or we may use something like dirt or gravel if it's an outdoor facility. All of these can be adequate for footing on the cattle. But when we have just bare concrete that starts to get some manure or urine on it or water or ice, it can cause some trouble with cattle movement. When cattle come into a working tub, two of the bigger issues that we see, one is the tub needs to be the same width as the alley that's coming to the tub. If we have a 12-foot alley, we need to have a 12-foot entrance to the tub. If we have a 10-foot wide alley, we need to have a 10-foot. When we start to taper that towards the entrance to the tub is when we'll have trouble with cattle coming to a point, turning around and balking on us. The other one is the angle in which the cattle enter the tub. And basically, as you can see from this picture that was drawn by Temple Grandin, if the cattle are coming in from a point where they are almost returning from the direction in which they came, they don't turn around. And for human safety, when you're grabbing that gate, the only thing that you're seeing is the tails of the cattle. If the tub comes straight into a bottleneck, you'll have those cattle turn around. You'll have cattle coming back on top of you, and that can be a huge danger issue. When we come back, we're going to talk a little bit about the bud box and moving cattle through the snake. We appreciate you watching DocTalk. Thanks for joining us.
The BQA Tip of the Day, sponsored by Behringer Engelheim Vetmedica Inc.
Hello, I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today, on our quick tip of the day, we want to talk about withdrawal times. I've got a question for you. I'm curious if you're following your withdrawal times, or if you've ever had FDA come visit you because you've had a residue pop up or they're looking for a residue. What happens when FDA shows up is they've had a residue pop up at the packing plant. And from there, they just work their way down the line trying to find out where that drug was given and who didn't obey the law and obey the withdrawal. So it's vitally important as a producer that you keep very accurate records, handwritten records, or computerized records so that every drug you give, you have the withdrawal established. Please don't send animals to the next producer or sale barn without making sure that they are off withdrawal.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hi there, I'm Dr. Dan Thompson. Be sure to join me at the 47th Annual AABP Convention, September 18th through the 20th. I encourage anybody that's involved in the beef or dairy veterinary profession to attend. Reconnect with other professionals and learn about the practical applications in the beef and dairy industries. There will be scientific sessions, clinical forums, and over 100 animal health exhibitors. If you're a practitioner, a technician, or a vet student, join me at AABP. I'm Dr. Dan Thompson, and I'll see you in Albuquerque.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here from Kansas State University's College of Veterinary Medicine. We just talked about tubs, and there's another way of crowding cattle or moving cattle into the snake at the point of the chute when we're working them, and that's called a bud box. And here's a diagram of a bud box, and you can see that this is basically a bud box if you're using panels. It's 2 panels long, 1 panel wide, 2 panels long, and then you have a catch panel here in the middle. But it's just an extension of the alley, and these are open-sided fences and gates if you're going to use them. And what we do is we'll bring the cattle into the bud box. Rule number 1, you can never bring more cattle into the bud box than what you can fit in your snake. And this has been taught to me by Dr. Tom Knopfsinger, so I can't really take credit from this, but I'm going to pass it on to y'all from him. So as the cattle come into the bud box, we're going to catch this gate and shut it right here at the point of the snake, okay? And we catch this gate, and then we're going to park ourselves or our horse right here where this blue dot is. From that point forward, we're going to move towards the cattle, and the cattle will come out of this end, and they will come around the person or the horse, and they will go right into the snake. And I have an example here of utilizing this bud box, and you can see that they're bringing the cattle here into the bud box. This over here is the Daniels alley that goes straight away from this bud box. They shut the gate that comes even with the snake that they're wanting to bring. They move towards the cattle, and as they step towards the cattle go right around them, and they go right down the alley. So tub or bud box, both of them are very effective and can be utilized. There's a debate on which one you want to use, but I can tell you that both are adequate facilities and things that you can utilize to move cattle through. Okay, when we get to the point in time of the snake, one thing that we have to understand is the path in which we are going to move those cattle. And the way that you move cattle forward within the snake is shown here and depicted. You want to move against the flow of the cattle, and as you pass the point of the eye or the point of the shoulder, either one, as you move past the eye and the shoulder, these cattle are going to move forward. And if you want to slow the cattle down, you move with them. If you want to speed the cattle up, you move against the flow of the cattle in the direction that you want to go. Some of the things that we've utilized also to move cattle, some of these hydraulic chutes set off the ground. We've used expanded metal to build a ramp up into the chute. And things that we can do to improve traction, improve mobility of going up into the chute. When the cattle exit the chute, this is a good example of some rubber matting that you can place on the exit portion of the chute. These are found in many of your beef magazines, and you can look in ads and find people that are making these woven tire mats, and they're extremely good. Just because we use hot shots doesn't mean that we can use sorting sticks to crack cattle on the backs. And this is an example of cattle that have linear bruising from our using sorting sticks. So good animal handling is important. So we're going to do more on cattle handling as we move forward with DocTalk in the series. And I'll bring in some guests and show more facility pictures than that. Remember to always work with a veterinarian. If you want to know what we do here at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson. Thanks for joining me today on DocTalk. It's been my pleasure to spend the morning with you, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.